In other global news, U.S. President Donald Trump has signed an executive order calling for a rethink of school vaccination requirements and pushing for separate vaccines for measles, mumps, and rubella instead of the combined MMR shot.
The move comes as the U.S. faces its worst measles outbreak in decades and has drawn strong criticism from medical experts. Trump signed an executive order urging states to review vaccination requirements for school enrollment and attendance. But there is a key limitation. The federal government does not directly control school vaccine mandates. Those decisions are largely made by individual states.
Now, the order also directs the U.S. Health and Human Services Department to work with the private sector and other countries to make separate measles, mumps, and rubella vaccines available. Medical experts have strongly criticized the move. The American Academy of Pediatrics say children should continue receiving the combined MMR vaccine, which has decades of safety data. Experts also warn that separating the three vaccines could create additional appointments and delays, making it harder for some children to receive full protection.
The issue is also closely linked to Health Secretary Robert F. Kennedy Jr., who has a long history of promoting vaccine skepticism. Trump and Kennedy have continued to raise questions about a possible link between vaccines and autism, but that claim has been repeatedly debunked by decades of scientific research. There is no established causal link between vaccines and autism.
Now, the timing of Trump's order is particularly significant. It comes just as children across the U.S. prepare to return to school and while the country is experiencing its worst measles outbreak in 35 years. New York City Health Commissioner Alistair Martin criticized the move, saying vaccination recommendations should be based on science, not politics. Republican Senator Bill Cassidy, himself a doctor, also warned that the initiative could increase vaccine hesitancy and make children less safe.
The order does not immediately change vaccination requirements across the U.S. States retain the power to set their own school vaccine rules, but the move signals that changing Americans' vaccination policy remains a major priority for the Trump administration at a time when measles cases are surging and public health officials are urging parents to keep children protected.